Welcome to DentalXP.com. I'm Dr. Maurice Salama, and I'm going to be discussing with you a case, as you see here, on a frontal view of a patient with existing crown and bridge work, recession that has caused her some aesthetic concerns in the area of the maxillary left lateral and left canine teeth. This is a common issue in modern dentistry and often is a concern not only because of aesthetics but also in terms of erosion and sensitivity. Today we're going to utilize the VISTA technique, the vestibular incision subperiosteal tunnel access technique, which was first proposed by Dr. Homazadeh. Here we're probing the areas approximately 2 to 3 millimeters and finding out through bone sounding where the remaining bony levels are, both labially and interproximally, that provide us with the proper Miller or PD Miller classification. This has been classified as a class 1 recession defect, and we're going to go ahead and debride the outer area of the cementum, removing all of the infected tooth structure, but also removing the smear layer. We like to do this before we reflect any flaps, and then we apply a root conditioning agent. In this case, this is tetracycline, for approximately 3 minutes. The tetracycline allows us to disinfect the root surface, but also to remove the smear layer and to open up the dentinal tubules to allow for proper attachment of the graft. The VISTA technique, as professed by Professor Zadeh, allows us to enter this area through 2 vestibular incisions, one on the mesial and one on the distal aspect, approximately 1 tooth on either side of the defect deficiency. Utilizing the VISTA periosteal elevators, VISTA 1 and 2s, as well as the 3 and 4 with the bayonet tips, we can now extend our flaps from one incision to the other. And here you can see how the bayonets allow us, with the proper curvature, to enter the defects depending upon what side of the mouth we're working on. And we're now extending that flap all the way through, but not extending into the sulcular incisions. So we're able, utilizing these small and long 3 and 4 bayonet instruments, to make sure that we have reflected the flaps all the way from the vestibular vertical incisions all the way down to the sulcus of the teeth to be grafted. You can see here now we're in communication with the sulcus on either teeth. We extended it into the interproximal areas, and we're now testing to make sure that we've relieved the flap enough to be able to apply tension-free closure once the grafts have been positioned. And you can see how that instrument now is being extended, the VISTA elevator, all the way through from the mesial to the distal vertical incision. We're going to be utilizing acellular dermal matrix material. In this case, perioderm is going to be the graft material, and we're going to saturate the perioderm in a blood-borne bioactive modifier. In this case, it was plasma-rich in growth factors, or PRGF. The perioderm is now going to be placed into the incisions and extended all the way from the mesial-most vertical incision to the distal-most vertical incision. We're now going to utilize a vertical sling mattress continuous suture to allow us to not only secure the perioderm to the outer flap, but also to secure it around the lingual aspect of the lateral and canine, and to utilize the lingual aspect in a sling form to actually vertically extend the flap all the way over the recession defects. This is a little bit different than Dr. Zadeh's technique of utilizing horizontal sling mattress sutures secured by light-cured resin. And either technique works well. I'm not as comfortable with light-cured resin material, so I like to use this suture technique, which I believe also provides us with tension-free vertical positioning of the outer flap. Here we're doing it again. One more suture is applied on the distal aspect, again in a vertical continuous sling horizontal mattress approach. And now what I like about this approach, again, it avoids any kind of composite resin to the existing crowns, relying on that composite resin and doesn't break, but also it connects the perioderm to the outer flap and compresses it against the teeth utilizing this vertical incision approach. And this is something that I go over in great detail during my soft tissue hands-on course here in Atlanta and around the world. You can see as I start now to secure the second suture, as I start to pull on the suture, it compresses and vertically extends the flap and the perioderm over the exposed or previously exposed root surfaces. Only at that time do I close my vertical incisions, and again utilizing a 5/0 or 6/0 vicryl or nylon suture is my preference. In this case this is vicryl, as the patient lived out of town. A horizontal crisscross mattress suture is utilized to approximate the vertical incisions in the VISTA technique. And I've been very fond of utilizing this technique, utilizing the Duell VISTA instrumentation that was created by Dr. Zadeh. So here you can see 4 sutures approximately were utilized, 2 vertical incisions, and utilizing these VISTA instruments to allow us to coronally advance the flap over the recession defects and add thickness of tissue utilizing the perioderm. Here you can see the preoperative view the day of surgery, and this is at approximately 2 weeks. You can see very, very nice healing, and then very important as well for a patient with an otherwise moderately high lip line. When the patient smiles, you can see the thickness of the tissue that's been added. We have very good root coverage. And the before smile, you can see that that was an issue. And then on the after, we've been able to gain a very, very nice result. Once again, thank you for spending the time with me today, reviewing this very unique soft tissue procedure utilizing the VISTA technique, and I hope to see you again on dentalxp.com.